everyone. It's your two favorite doctors. I feel like that's accurate, right? You're just gonna laugh. I'm Dr. Akilah today, and
I'm Dr. Joy Cooper.
who is telling us that during the pause is the ideal time to listen to stories. And what are we doing?
That's an Alice Walker quote. So listen to us.
It is. And there's more to that quote, which is great. But we are talking to you from our homes because we are in a place of sheltering. We're sheltering in place. This is day 26 for me.
I'm not keeping count.
I know you're not counting, but many of you know that Dr. Joy Cooper is a OBGYN, so she's still working and giving us these babies and taking care of the mom.
They still coming.
Yeah, they're not going anywhere.
More are coming now, I think. They're on their way. More
are coming. So we're here today because we want to give you an update of everything coronavirus, novel coronavirus, COVID-19.
SARS-2.
SARS-2.
The official name of the virus.
SARS-2. You're right. I love that up. That's the revenge of SARS.
Or in layman terms, the Rona.
The Rona.
That's our culture.
I've also seen Miss Corona, and I was like,
okay. No, that Rona, because literally my friends who are even doctors would be like, let me tell you what that Rona did.
That Rona, true. I think it's important to note that it's Monday, April 6th. Dates are hard now because we only have 3 days. Joy, what are those 3 days?
For me, at least, they're yesterday, today, and tomorrow.
Boom. So we just want to give you some updates. I think the first one is that just a couple days ago, CDC announced that everyone in America should be wearing some type of mask, whether it's a cloth mask or bandana or scarf outside. It's important to note, not the N95 mask. You don't need that. You're not in the hospital. We have to make sure we keep that PPE for people who are working in the hospital.
But if you already had some, because some people do have them, just know that that's more, it has a filter so that small particles can't get through. And while we do not believe that coronavirus is airborne, I'll say that loud and clear, it's more so just to protect your mucous membranes from potentially being exposed. And the one thing that the CDC won't say to you, because it just doesn't make sense in layman terms, is also, honestly, if you really feel like you're out and at risk, especially in these big public places where, you know, everyone's flooding the supermarkets and the Costco lines, all these different things, have your eyes covered, sunglasses or regular glasses, just because your eyes are actually linked to your nose. So if you just imagine, like sometimes when you cry sometimes and you try and hold like your tears, you kind of start sniffing, like that communicates with your nose and therefore your pharynx and your throat. So that's still a way that if something like, you know, droplet gets to your eye, that's also a way to like transmit the infection to the place where it actually lives, which is in the back of the throat. So, you know, if you really want to be safe and really like, you know, really feel like I was out there and I didn't get that Rona, please, you know, with the cloth mask, also cover your eyes.
Yep. And, you know, masks are a great reminder to not touch your face, which we shared on the other videos with you. You're still not touching your face, especially your mouth, nose, and eyes, as Joy wonderfully shared.
And there one more thing is the way you take it off. So make sure you don't touch your face when you put it on. Like I know even in the hospital, I see some people put the regular mask on and then they bring it under your chin and keep going back and forth. So potentially you're touching your hands on the place where you're trying to block it from coming. So you're touching it, touching your hands to even put it back on, take it off. Right. So really you want to use it so that you take it off at the ear or wherever your mask is, take it from the behind and then take it off that way. Just try and make sure you wash your hands after you handle the mask.
Exactly.
And you're not using it, don't bring it and put it on your couch and then lay on your couch and bring your face there. Like it's something that, you know, you should like leave at the front door or leave outside if you have a space. Like you just do not want to have that like just all around your house all willy-nilly.
Exactly. So me personally, I have a cloth mask with a filter in it, and it connects behind my ears. So I take it off one side and then it goes near the front door. My front door is like my like ET staging area. So like everything comes off by the door, and then I am the outside outfit, the outside shoes, and I immediately wash my hands and then, you know, put everything where it needs to go. And then I also wash my hands again. So for those of you who remember from the other video, I am in the really cool kids category with the vulnerable population, since I do have a heart condition. So I'm actually not going outside. So that's why I know it's day 26. My going outside is taking out the trash, and I breathe in the air, not by the trash though, away from it. It's nice, and lovely. I'm also not going to the grocery store or anything of that nature. So just to minimize my risk. This is a wonderful time to remind everyone that as we're sheltering in place or quarantine or social distancing, depending on where you live, that not everyone is doing it the same way. Some people have people at home that they like or they don't like. Some people have pets, and some people are by themselves. I am doing it by myself, and you know, not all of us are lucky enough to be in a situation where we could have someone else make food. Joy and I had a very long conversation about how we are tired of preparing our own meals.
So tired.
So tired. Cereal
Even like a
tonight.
hobby of mine. I think that's the funny part is that like I actually love cooking, but
I know.
it's like it's better when it's like, oh, let me come home and then cook tonight, as opposed to like, all right, what you gonna eat, girl?
Yeah. I know. I know. I feel you.
And
So
back to what
anyway,
you said too about like the difference. So shelter in place is different from isolation, which is different from quarantine. Those different, I know we use them interchangeably for like,
it's
our
different from social
hashtags and stuff.
distancing. Yeah,
That's which is different from social distancing. The general term in general for, what we've been saying for more than a month is like social distancing, which is like making sure you're 6 feet away from people. And relying on our smartphones, our computers, FaceTime, Hangouts, house
Zoom.
parties, all Zoom, all these
House
apps.
party is so much fun. I just did it this weekend.
I
I
think
had
we
a blast.
can do it in like an hour or so, I think. So, there's all these different, that's social distancing. But then when you start saying shelter in place means that you're supposed to stay home unless you need to go to the supermarket or do things that are essential, or if you're actually an essential worker and have to go to work.
Exactly.
It does not mean
Or you're
it all
taking care of someone else if you're a caretaker. So
and
a
you
parent
exercise,
or me, I fall into that category. Like if
or
someone's coming to bring in
bring you
food
food.
to me or whatever. Yeah.
So you can also exercise. So when they say you can exercise, that does not mean that you can go to the lake and whoop de whoop with everybody and their mama. Because I've seen it. It looks like Freaknik outside sometimes, and that's like
Or a sideshow. Let's just throw that in there.
those things. Oh well, yeah, that part I did hear about that. Oh, I'm from Philly. I'm like, wait, oh yeah, that cultural thing that we do here in Oakland. So those are things that you're not supposed to do, but like you can go outside and exercise. But I would encourage you to look for new places. I'm actually looking for new places to like hike and walk so that I'm not around a lot of people. So that if I
Yeah.
do want to go outside, I'm not close to people. And then lastly, isolation is different from quarantine. So isolation means you're trying to like staying at home with the people that you live with. Quarantine means I'm staying at home, but I'm in a room separate from everybody else in the house, and they can like leave food at the door or something like that. But you cannot be out all willy nilly hanging out with people in your house.
Or quarantine also falls into the category of you've been next to or near someone who's been exposed or who has contracted coronavirus. So you're doing a self quarantine. That's another term we're hearing too, and quarantine. No one is quarantined if they're just at home. If you're at home, you're sheltering in place.
Exactly.
So and I've caught myself saying quarantine. I'm like, nope, and I correct, nope, shelter in place because I don't have anything. I'm fine. I know that I'm fine because I've been inside for 26 days. I've gone past that, 14-day mark, which we'll talk about in a second. But this is the time to remind everyone to look at your sources of information about what your city or county or region or area state is doing to minimize exposure, risk, and spread. So look at your city health department or your county health department. Sometimes you may have to look at both. Sometimes they're the same, sometimes they're different. And then look at what the state is doing. It's important to note that the state rules do at some times supersede your city county rules. So right now we're in California, and being that we're in California, we have our shelter in place order was until April 7th, but it was moved to May 3rd. But in between, right after we had our shelter in place, the state put an order in place, a shelter in place order, and it is indefinite. So there's no end date on that. So there's just layers to it. So take a look at that. But another reason why you're seeing all these different levels that Dr. Cooper shared so beautifully is because of incubation time. So we wanted to share that there's some updates around incubation that makes it different from the flu when initially things were more similar to the flu. Take it away, Dr. Cooper.
So when we talk about a virus and how infective it is, it's like how virulent it is. And so basically because coronavirus can linger for 14 days without any symptoms or anything, that is like the incubation period. You could have gotten infected on day 0, but did not actually like show symptoms until day 14, technically. Usually most people do show symptoms between 2 to 7 days. So usually that's like, if you're going to have symptoms, that's when you actually see it. But just know that there's 14 days that you could be like virulent as a person. You could be a vector. I call it like,
Mhm.
it's called vectoring. I've said it in my friend on hangouts and people are like, stop talking doctor, but you're a vector. You're like going
Or
places, you could be
vector.
infecting people and not know it. So that's why it's like 14 days of quarantine is when we know like, okay, we know you don't have the Rona. Whereas if it's only been 7 days, we're not sure. The jury's still out on that. That said, a lot of what we've been seeing, I think in the first wave of people turning positive was a lot of asymptomatic people.
Yep.
And that's because people were getting tests because they were close to, or and that's also because this is America and we have all these resources. We, are one of the richest countries in the world, but we don't put resources where they should go, like health. We don't have a lot of tests. So unlike like a place like South Korea, where they had their first infectious case on the same day as we did, they're doing it totally different because they're screening their whole population. If you want to get tested, there are drive-through places you can get tested easily. We don't have that in America ubiquitously. We have that like certain places, depending on, like San Francisco just got it. There's Pier 30, 32, where you can just like go and get testing if you just to make sure you're negative if you want to do that. But that's the resources that the city of San Francisco put aside. The
Right.
US, we don't have a general strategy for screening. And so because we don't have that general strategy, I would behoove you, if you don't have symptoms, even if you potentially were exposed, you can like isolate yourself, but do not do not feel like I have to go get tested to confirm that. A, you might not get it because every hospital has their certain amount of tests that they can do per day or can do per week because that's the allowance they were given. And we still do not have a pipeline for tests. So don't feel like just because I knew somebody, unless you were intimately close, like y'all were like playing cards or y'all were hugging it up and whoop de whooping at the church or at the
Mhm.
funeral, or like you lay next besides this person, those are reasons that you have a close contact.
Right.
So you do not have a right to a test, and even if you feel like you do have a right to test, I have friends whose parents were like obviously had coronavirus and hospitals like, we ain't got it, so just go home and self-isolate and self.
Right.
So
Yeah.
just be prepared for that.
And I think it's important to note that we're seeing a lot around power and privilege, particularly around racial health disparities when it comes to coronavirus. But before we get into that, I think it's important to remind people that there's no vaccine yet, and the vaccine will be really crucial into how we are able to get to a new normal and fully like re-enter. So there's really no known time where it'll be safe to do that. But just looking at how other countries are doing it, even people like China, if you're coming back into like the public space, they're still having to wear masks and still washing your hands and not touching your face and having that social distance, which is um, Governor Newsom actually said it really well. Social distancing, but it's really physical distancing because you have that physical space, between people. Like you'll still have to potentially have those patterns. So there's lots of different countries and universities and labs that are working on different types of vaccines. So there'll be some time for that. And then a reminder that there's still a lot unknown, which is why we're doing this up-to-date video where there's a possibility of things, dying down in the summer, towards the end of the summer, but potentially coming back in the fall. All of this is contingent upon when a vaccine comes into place. And the other thing that Joy talked about so beautifully, which is testing, right? So let's talk about something fun. And that
Uh-oh.
is
I didn't say
our healthcare system is
failing.
what?
Failing us. Oh,
Okay,
it's like
that's a better way
Filipino.
to say it.
Sorry,
Yeah.
Filipino.
It is. It's failing us. So, in the past couple days, there's been great articles between the New York Times,
Well,
Publica, even in
Milwaukee, Detroit, New Orleans,
Wired. Yeah,
Chicago, every like even the small news outlets are like pointing out startling statistics.
startling. Yeah, ProPublica has a great article.
Yes, article too.
The Atlantic is doing a great job on that as well. But essentially, what we're seeing, this is where I get to be my public health nerd. What we already know about health is that Black, we'll just keep it simple, communities of color,
Well, actually, I would say Black because right now the data they have is on Black people.
right, especially Black, is what we know about Black communities, is that we have horrible statistics around maternal health, um, diabetes, heart health, so hypertension, um, kidney disease, all the
Asthma.
fun things that make you part of this immunosuppressant community for coronavirus. But plot twist, because it's America, we already know that symptoms and pain for Black people is not taken anywhere as serious as a white person or a white patient or counterpart. And so you have Black people who are not being treated equitably or fairly in hospitals. You have Black people who have a long history of fear of hospitals that are not going in for care. And then you have Black people who are not, they're underinsured, not insured, or even with their insurance are dealing with implicit bias and discrimination. Now, on top of all of that, what we do know about America is that there is a higher population of Black people who are deemed essential workers, right? And essential workers now are obviously grocery store workers, delivery workers, Amazon workers, even postal, employees, garbage workers, like
Transportation workers.
boom. And they're out and about and they are dying. They're dying and they are spreading coronavirus in their homes as well. This is America.
And then also the other thing I want to point out is that, in addition to having coronavirus at higher rates, we're also dying at higher rates. So I think they said 72% of all the deaths in Chicago were Blacks.
Mm-hmm.
It's really severe in New Orleans, Atlanta. If you look at, these are all cities that have lots of like a huge Black population, and Detroit as well, Milwaukee
Yeah.
has some deaths as well. And I want to say one more thing about infections, because I have a master's in STDs, so this is obviously not an STD, but one thing about
Like
infections
the
is that
spread though, like the STD.
close. So the other thing about infections are they're about networks. So you can't get an infection unless you're out in that network. So if you're outside and this is why we're saying stay home, because you won't get it if you stay in your house.
Right.
Unless, we don't know everything, but if you look at a place like New York and Italy, the places where things have gone crazy are where people live on top of each other.
Mm-hmm.
And so you have a lot of people in a small amount of area. I don't know how, air filtration systems work in some places. So, those droplets could potentially like spread all over and we just don't know. So I will say that to just say like, it's not a perfect science that if you don't go outside, because there are some other ways that you can get it. But that said, the thing is, if you're not outside, you're not in that network. And so I would say these statistics, I hope don't make Black people scared and do not make African Americans feel like, oh my gosh, like it's a conspiracy. Because trust me, sometimes I want to go there too. But I was already thinking conspiracy when, at least 800 Black women die every year giving childbirth, doing childbirth. So, and that was that was considered like a nominal number. Like, oh, that's not a big deal to some people. But that's 800 lives. So just imagine the thousands of lives that have died from coronavirus already in our community. And that's a huge loss. So in terms of your network, the key thing is, the problem we know America is segregated, especially in terms of where you live. So the problem is like if it gets into your community because people are working and they bring it back into their home or bring it back to the community because people are still having birthday parties like there's no tomorrow and hanging out and stuff. Again, we know our community, we're on the front line. whether that be cleaning at the hospital, nurse at the hospital, doctor, anything.
Any
They're
yeah,
also on the front lines, being transportation workers. They're exposed to whoever comes across,
yeah.
their station or whatever. So just know that like that's a reason for us to be extra careful and to be extra aware and be less likely to go out because we know we're at risk. The other part of what Akilah said, we know we live in environments where there's a lot of asthma because there's a lot of environmental racism, and we live in communities where our children grow up with asthma. Moderate to severe asthma is a risk factor. And the thing that we're uncovering uniquely in America, because this is a place where we have this problem and not anywhere else in the world as much, is obesity. So you could just not have high blood pressure or diabetes, or maybe they just were never diagnosed, but being obese in itself is a risk factor for not doing well
Exactly.
with coronavirus. We just didn't know that because in China, they don't have a lot of obese people. In Italy, they don't have a lot of obese
No,
people.
you gotta come to America to know America. That's with the capital M.
And so honestly, I'd be really curious to see, and just so people know that 4 out of 5 Black women are overweight or obese. So already like that puts Black women at a really high risk. But even on top of that, I'd be curious to see if they did a map of food deserts and did that with Corona, how that matches up. Because we know these things are systemic and these are things that we know in our community. It's
Yeah.
hard to get to like good food that's healthy, but we got all the chicken and liquor stores in our neighborhoods, but we don't actually have like pure full
Well,
on.
but and also fast food, right? Because what we do know of food deserts is that you will go to McDonald's and KFC and Popeyes to
Exactly.
get that. And those establishments aren't saying we're going to shut down, so we're going to not encourage people to come through the drive-through. They're doing contactless, drive-through window things. But that's still putting you at risk. So I think the message is really important of what you're sharing there is that what I love about Black people is that we have a sense of community, right? And we want to be together and we want to keep things in control as much as possible, especially when we sometimes feel we're in a country that is not for us, right? So I'm going to go to Popeyes. I'm going to get the chicken sandwich. I'm going to do that. But wait, and bring it back home. We're all going to eat it together. And blah, blah, blah from up the street or blah, blah, blah is going to come over from a different household. But what's happening there is that you're going outside. And anytime you're going outside, you are increasing your risk of exposure and passing it to someone, depending on what you're touching and who you may be interacting with, who may be asymptomatic, right? So yes, I feel it's important that all communities take the importance of staying home, like just getting at that level. Because in California, people are like, "I'm gonna go to the beach and hang out." It's like,
It's the same thing I say for like maternal health. Like I just tell Black women who are having babies, like just be aware that you're going to be at increased risk of certain things.
right,
It's kind of the same. It's having this like just knowing. And the thing for me is it's about your risk assessment. Nobody can do a risk assessment for yourself like you can. You know what you're
right,
at risk for. So you
right,
don't need the TV to like induce that panic. You got to live your best life, and you really need to be. Like we know viruses, your immune system has to be in tip-top shape. So you really want to try and like eat more. I'm sounding more like a hotep, but I will. There's been evidence that being more having foods that aren't as inflammatory. So like less meats and more vegetables and more vitamin C to help your
yeah.
immune system. Like
Vitamin
zinc
D as
actually is
well.
something that we prescribe patients who have coronavirus, zinc to help you. Like there are things
Exactly.
out there that, or there was a Jamaican doctor who I think used the ginger, garlic, and I forgot the last thing, tea that people just make
Honey.
in Jamaica. Like there are, I mean, those things still work. They're
That's
about
what the Caribbeans do.
big things like one, so we need to pivot and make sure we protect
Bow,
ourselves.
bow, bow, bow.
Okay.
Yeah.
Let me go plug in my computer, but keep talking.
So Joy is right. This is a real life scenario right now of all the Zoom calls that we have and making sure your phone or your laptop is charged so we can do all these things. But it's true. Like the thing that's happening right now is that CDC is not reporting what data is looking like by ethnicity. And as a result, if they're not doing that, then it's pretty much up to health counties or health jurisdictions to report um, contracted cases, positive cases, and also deaths as a result. So, for example, you brought up Milwaukee. Out of the 945 cases they had of last week, the deaths that they had, 27 deaths, I think. Um, 81% of the deaths were from Black people, right? So we're going to see this continue because the healthcare system has not done a great job of taking care of communities of color, but particularly of Black communities. So that self-care, that self-awareness, boosting your immunities system is important. Getting
Yeah,
exercise in a safe way is important.
we don't trust. And I think there are reasons why we don't trust the police. We don't trust the government when they say stay at home. We don't trust apparently 5G towers. That's a lie. It don't have nothing to do with
Oh,
Corona.
stop
Um,
it. Nope.
we don't trust, doctors. We don't trust the healthcare system. And I understand. I have definitely navigated with my friends' parents about trying to get them access, and in the emergency room and being told you probably have it, but we're not going to do anything unless you're sick enough. But like there are different things that China did to see, who would be high risk. Like they did low grade CT scans on everybody. We're not doing that here because nobody wants to deal with the costs. And this is the
Exactly.
America.
The cost, right? So here's a fun fact. As of right now, if you contract coronavirus and you don't have insurance, your bill's probably going to be a minimum of about $33,000. If you have insurance and you contract coronavirus, your bill is going to be around $9,000. Now, let's take some fun factors and throw it in here. Loss of income for one person in the home, or that one person lost their job, furloughed, reduced pay on unemployment, and they have to, rebuild. And you can't just go out and find a job. There are places who are hiring. I have promoted that on my Change Cadet Instagram, which is great, but that isn't the case for everyone to be able to find a job right away. So people are surviving coronavirus and going into a whole new level of debt. And we already know how many Americans are in debt to begin with. So there's, in addition to what's happening in our communities of color and Black communities, you're going to see um, just, just really drastic negative outcomes for getting to a place of, rebuilding as communities, as cities, but also as individuals who are trying to make it through Rona, you know? So, what can we say that's positive?
I
Drake
mean,
gave us
I'm
the,
still here and I'm glad to be here and I'm grateful, but there's definitely a part of me that's still like Biggie, ready to die. You just do not know what's going to happen.
you don't, you
Different
don't.
prayers in order, as my grandma said, confess your
Yeah.
sins, but,
And
you
then
know,
reach out to people too. Like, it sucks being alone. I cannot stand it, but I'm thankful for being able to video chat people, and, have conversations that way. I'm an old lady. I yell at the window, good things and bad things. Thanks, garbage workers. What are you doing? Like, I mix it up. I just mix it up.
I mean, I think the two words that I have tried to that keep coming to mind basically are gratitude and grace. And I would say, yes, I'm grateful for all the things that I have. I'm grateful that I have job security and that I
Yeah.
despite having to be on the front lines and deal with whoever might come onto labor and delivery, asymptomatic or not with, coronavirus. I'm grateful I have a job, but I also think grace. I am not one of the people who is, on Instagram grandstanding saying stay at home so that I don't have to go to work. I have to go to work regardless, and I'm happy to have a job. I really think like we have to give grace to people because a lot of people, they're like, we know people of color on the front lines for this whole thing. If you look at where the virus wreaked havoc in New York, it is in Queens, in an area that is like mostly immigrants, mostly people who have lots of people living in one household, and people who are essential workers. And this is the grace that we have to give, is that we have to understand that the way America is set up is that, the American dream is such that a lot of people come here looking to, get their dream. And sometimes it's their children. And sometimes they work hard and work crazy hours to make sure their children are the ones who get to live that American dream. And the grit that it takes to get there is a lot. And if you look at that community that's been, ravaged out in Elmhurst, New York, it's because those people are at risk, and those people, are the TSA workers that, were exposed to whoever was coming in out of the country. Those are the people who, clean and drive taxis and all these different things. And so for me, it's like we have to give grace because people who are still out there, kicking it, it's because your life is hard and you might be on the front lines and you like, when I come home, I don't want to sit in the house. I get it. And I'm trying to extend you grace, but I want you to, my goal for if I could speak to our community and those people who are most at risk of more mortality because of the comorbidities. I'm gonna say that
Mhm.
again. Those people who are most at risk of mortality because of their comorbidities, including obesity, including asthma, including hypertension or high blood pressure, including diabetes, including immunosuppression, like those people, I'm saying you have to live your life differently so that you can
Yeah.
survive. Like this is really on some other stuff. I really, just want to give you grace and I see you. And I don't want you to stay at home for me. I want you to stay at home for you.
Yeah. And as someone who falls into that category, I have an immense amount of fear of going outside, even to like take a walk, because I go to the ER on a good day. So I don't want to go. I do not want to go now. And if I went to the emergency room, I couldn't have anyone with me because I'm not going to put anyone else in, an opportunity to potentially contract something.
They want to
Um,
let you stay in with you, honey.
no, I know, but I mean, the last time I went in June, I could, have my
Exactly.
sister with me, right? But this time I couldn't do that. So I'm sacrificing a lot in order to stay healthy. And, I like to say that the moments like this, these are temporary sacrifice moments, right?
Mhm.
And you are exactly right, Joy. Like it has to start with you and doing it for yourself. It really is like the biggest self love act that you could do for yourself right now. Because what we do know is that things are going to continue to change. And here in America, California, this is supposed to be the peak week, right? Where, things are, going up. So this is a really important time to stay in. But yeah, just take care of yourself
And
so that we can take care of each other.
we can work from home. I work my side hustle obviously on home, which is a telemedicine startup, which is in high demand because everyone's looking for ways to communicate with their doctors now. But I think, we're saying this as privileged people. Like, I don't necessarily obviously I'm not privileged enough where I can just like, I ain't working today. But, I think at the same time too, there's so many, I think really probably the reason why it's not as crazy in the Bay Area is because first of all, we pushed out most of the social economic classes that could not live here because it's so expensive to live here. So you don't have as many of those essential workers living in these spaces.
Thanks.
I'm just going to say that. And then two, the people who do live here can really work from home. And
It
so,
can. Yeah, I mean, we're in Tech Central, but
yeah,
people are still on BART.
yeah.
Yeah.
I mean, BART is almost essentially down. Like they were down 90% ridership like weeks
I know,
and
but
weeks.
we can't not have BART because we still have essential workers who have to get to work.
But
And
luckily, it's not like in New York where essential workers are on trains with a pared down system. They're like on top of each other in New York because that's how many people are essential workers and need to get to work on the train. The two train picture like still sits in my mind of a lot of people like intimately close around a pole, trying to hold on a pole so they don't fall on the train trying to get to work. And that is again why it works differently. If you look at a BART train right now, ain't nobody on there. You got all the space in the world.
you have a whole car to yourself.
So again, there's a lot of privilege even living in the Bay Area, and I'm hoping it continues to stay like low.
Yeah.
But at the same time, too, we just don't know what's coming out there, and we don't know because people
Yeah.
are still, moving around the country, and so
Yeah.
whatever crazy virulent strain that is in New York could make it here. We just don't know. So
Yeah. I mean, I guess, the takeaway is obviously self care, stay your ass at home. There are unknowns. We do recommend if you want updates, the CDC is really more so a guideline. But again, going to your city and county health departments, New York Times has content too.
changes.
Hmm?
Like, be prepared for changes. Like the CDC
Oh yeah,
updates like all the time, and I think again,
nonstop changes.
evolved. A lot of things have evolved.
Yeah,
Um, just as it's kind of got into our patient population, which is different from China, different from Italy. Again, this is a different healthcare system, and our healthcare system, as I said earlier, has failed us. And that's why you're all you got. Like I don't think Americans can save you unless you really need a ventilator, and hopefully then it does. But
yeah, and
even
then
if you don't know if you're going to make it on a ventilator, like, are there going to be enough? What are the decisions that they made about who gets on a ventilator?
yeah, and then the last thing I'll say before we wrap this up is that please remember there are people with health things going on, health conditions, invisible illness, chronic pain, disabilities who need things as well. A great example is alcohol wipes. So everyone's trying to, hoard alcohol wipes to clean their hands, but you have diabetics and people who have injectables that need those wipes so that they can take, life-saving medication. So stores are restocking all the time. There's no shortage of food. It's just people who are taking too much. Um, that also goes for people who are getting public assistance with their food. So here in California, it's CalFresh here. So making sure that you're not taking the food that is labeled for whatever your state has for people who are getting assistance to eat. There's only pretty much one time a month where their cart is refilled. So be mindful of that. So I think we did all the things. We
All the
shared
things.
all the things. Um, Yeah, just be gentle with yourself. New York Times has great articles and coronavirus content, COVID-19 novel coronavirus SARS-2. Content is free for New York Times. There's great visuals. And then Vox also has great visuals and content that's free as well. So we, as updates change and we feel it's pertinent to make an update here, we'll happily do it. But thanks for tuning in. Is
Yes.
that
And
what
one
we're
last
doing
thing,
now?
those places where, those cities that we cited that, I would say like Milwaukee and Detroit,
Detroit.
those places, there are a lot of cities that turn red. I mean, a lot of states rather that turn red, and their population of Black people are at risk now. And
Yep.
so this is just another call for us to vote when it's time, and hopefully we get to. But this is the reason why people say vote, because that's all I'm gonna say.
And on that note, thank you, everyone. Thank you,
Stay safe.
Dr. Cooper.
Thank you, Dr. Cadet.